Hello and welcome, everyone. Thank you for joining us at the Community and Public Health Practices panel of the Planetary Health Virtual Global Conference for Nurses and Midwives. I would also like to thank the Nightingale Institute for Global Health, which organized this amazing, innovative conference, and our many sponsors who support this gathering and the work we do around the world. As a bit of housekeeping for this panel before we jump in, I'm going to introduce three outstanding panelists. They will each have 15 minutes to present on the work they are doing related to community and public health practices from a planetary health perspective. Following the final panelist presentation, we will open to the Q&A. So please have your questions ready. For questions, we aren't unmuting. We can add questions to the chat, and I can read those to the panelists. So please add your comments to the chat. With that, let's meet our first panelist. Helen Boyd is a planetary health nurse and climate-aware mental health therapist whose career spans acute and critical care in Canada and internationally. Helen has a storied history of supporting communities affected by climate and weather-related disasters and educating health professionals about these disasters' psychological impacts. She is the founder of Caravan, a nurse-led mobile clinic delivering essential healthcare to equity-denied and unhoused populations. She previously served as British Columbia's representative for the Canadian Association of Nurses for the Environment, or CANE. Helen is currently the regional coordinator for the Climate Psychology Alliance of North America. Her work is now community focused on the lands of the Lekwungen speaking people known as Victoria, British Columbia, building climate resilient neighborhoods and supporting climate advocates through the facilitation of climate cafes where climate distress can be shared openly. Helen, welcome.
Thank you. Thank you so much. And thank you for this opportunity to talk about the mental health role of nurses in both climate distress and in climate disasters. It's my privilege to be here today to represent our organization, CANE. As Kent mentioned, I respectfully acknowledge that I occupy the unceded land of the Coast Salish Lekwungen-speaking people who have lived and stewarded these lands for thousands of years. This is also known as the city of Victoria, British Columbia, in Canada's West Coast. So thanks for having me. So let's delve into this right away with the mental health role of nurses in climate distress. Climate distress among youth is really prevalent. A study that was done in the Lancet Planetary Health revealed that over 10,000 children that were surveyed and young people in 10 different countries of widespread anxiety over climate change. So 50% of them reported sadness, fear, and anxiety, and they felt betrayed by their governments for not acting on the climate science that's already out there. So what can we do as nurses? Well, we know that a myriad of emotions are being experienced right now as we collectively witness the ecological impacts of climate change, and we face increasingly frequent, intense, and prolonged climate-driven extreme weather events. So this tool here that I'm sharing with you is called the Climate Emotions Wheel. And it's a tool that was developed by Dr. Panu Pikala and that we often use to help sort of navigate this myriad of emotions that people experience, who can go from fear and panic about the state of ecological distress to outrage and anger, and then also to periods of inspiration at the work of other nurses and other activists in community. So I really recommend this, and it has a QR code that leads to climate mental health resources as well. So what we can do as nurses is we can run climate cafes. So these are very informal gatherings. The purpose is to have a space for connection where people can actually process their emotions, whether it's about eco-anxiety or climate distress, in a really safe haven. So at the door, we sort of leave our climate action to really focus on our climate mental health, and so that we can resource ourselves and then carry out into the world and feel that we have the energy to continue our advocacy. In the words of my colleague and co-facilitator, feeling your emotions is an act of rebellion. And it's so very important to do that. And so climate cafes do not need to be a counselor. Nurses are well skilled to run these types of groups. So let's go a little bit broader in the mental health role of nurses in extreme weather events. So nurses' advocacy, our voices, is important because these climate extreme weather events are being felt disproportionately. They're affecting our low-income communities, our indigenous populations as well, rural and remote populations, pregnant women and children, and also individuals who are living with chronic illnesses and including mental illness. So for instance, schizophrenia, people who are living with schizophrenia during the heat dome of 2021 experienced 5 times the mortality rate. So I'll get into that in more detail a little further down. In my province of British Columbia, in the year 2021, we experienced 3 extreme weather events. It started with a heat dome that lasted in that timeline there. During 4 of those days, over 619 people died during the heat dome. 90% of them were over the age of 60. They died not as much because of the temperature outdoors, but because of the indoor temperature. So we have a very important role in terms of advocacy, helping buildings get cooling rooms for the advent of a heat dome or heat waves. Concomitantly, throughout British Columbia, wildfires were rampant. From July to September, in the interior, it was one wildfire after the other, obviously affecting air quality and the health of people. And lastly, in the same year, we heard the term for the first time, atmospheric river, a flood that basically just decimated our agricultural region of the Sumas Prairie in Abbotsford, BC. So this flooding, the costs are upward of $1.8 billion. And so these are just some of the events that we've had all in the span of 1 year. So what I want you to remember is that the mental health impacts of extreme weather events always outweigh the physical or the medical impact. So the hurt, the injuries, the trauma that could occur, it pales in comparison to all of the psychological trauma. But fortunately, we're experts at early intervention. And in this case, this is what is important too. That's key to lowering the impact of these events. So we'll look at a bit of the mental health impacts on individuals. What's really important for us when we respond is to help people know that the emotions and the reactions that they are having following a disaster are absolutely normal. We can anticipate that. They've just had a catastrophic event happen, and so we anticipate this. But what's encouraging is that for most people, these reactions are only temporary. They will not generally go on to become chronic problems. So that can sort of alleviate a bit of the pressure that we feel that everyone is going to develop trauma. That's not necessarily the case. They'll have a traumatic event, but they won't become a chronic problem. However, we will see psychological and behavioral responses to these disasters. The distress reactions, we anticipate those, as I just mentioned. Unfortunately, we'll also see people engage in health risk behaviors. We'll see an increase in the use of alcohol and drugs. Gender-based violence will often increase, especially during heat wave events. Separation anxiety is rampant among children. And there's also a fear of over-dedication of individuals who are wanting to save everyone and to save everything. And that, of course, can also lead to burnout. Some of the responses do lead to psychiatric disorders. So we may see eventually the signs of post-traumatic stress disorder, complex grief can ensue. People can develop severe panic attacks and episodes of depression. We do anticipate that this will happen, but far less than what we would expect normally. So what factors influence the psychological impact of such an event? Well, it depends on the type of event itself, its force, the frequency of it, and how much an individual is affected in their daily life. So if they have lost a loved one, and on top of that, they've lost their livestock on a farm, or they've lost their property, all of those, of course, compound. And so these losses that are incurred also have a huge impact on how they will be affected. What can nurses do? Nurses can get trained in psychological first aid, known as PFA. So again, this is a measure or an intervention that's designed to reduce the distress that's caused by a traumatic event and to help people regain their healthy coping skills. So it is a research evidence-based strategy that's used worldwide. On the left, you have a document that's put out by the Pan American Health Organization, and on the right is put out by the World Health Organization. Training is readily available in universities. It can be done online, in person, and what's most important to remember is this is a scalable psychological intervention that can be used in communities throughout the world. So my encouragement is people get their training in psychological first aid. Back to the Sumas Prairie for a moment and the atmospheric river. Overnight, a total of 15,000 people were evacuated from this region. And so fortunately in British Columbia, we have a team called Disaster Psychosocial Services. This is a team of volunteers. It includes nurses, social workers, psychologists, clinical counselors, psychiatrists that are readily available and deployed to these regions that are overwhelmed with disasters. And so I was very fortunate to be part of this team and spent a week in this region assisting people and delivering PFA. So a bit of principles of the PFA itself. So when you're thinking about this, think of Maslow's pyramid. So what we're looking to do is really attend to the basics of providing a place to sleep, food, clean drinking water, and of course, clothing. And this can be rendered by agencies such as the Red Cross, Salvation Army, the Good Samaritan Purse. But what we're there to help them with is often to be with them as they contact their relatives very quickly. We know that this will help bring down their stress to be able to connect with loved ones. And so that's a very important feature of what we support them with. And we work on enhancing their self-efficacy. We know that they have just been submitted to an uncontrollable event. So the more we can work with them instead of for them and support them in this process, the more they'll be able to regain that sense of control. And so I'm often asked, what is it that when we are in these centers, what do we say after an extreme weather event? Well, we invite choices to share or not to share. Essentially, that's what we're doing. So it's not uncommon for us to say, I'm here to provide support for you. If it's helpful, we can talk about it, what happened, and you can share as little or as much as you want. Some people are really wanting to show all of the features of the land that they lived on and that was decimated, and some others not, and that would be re-traumatizing. So we very much offer them the choice. What's also important is to ask strength-based questions. We want to tap into this. We want them to broaden their perspective, to know that when did help first arrive? Oh yeah, there was someone who came. When did you know that your family was going to go to a safe place? That's important. And then what we want to tap into is who is helping you right now so that they know that they feel some support. It could be a family member. It could also be an organization that's helping them. And then to tap into their sense of resilience, we may ask them this. When challenging events have happened to you in the past, how did you get through them? So they have a lived experience of having gone through that. And so to bring that forth can really help them navigate this crisis that they're facing. So let us look briefly at the community mental health impacts of these disasters. These are the post-disaster recovery phases. So what we often see is this impact where the event has occurred, and then there is quickly a honeymoon phase. And this is where everybody comes together. There's big community cohesion. People are delivering food, are delivering clothing, etc. But what we need to keep in mind as nurses is that when the services are withdrawn, that eventually there's a disillusionment phase, this stretch that goes down. When services have been withdrawn and when the Red Cross is no longer there, people are faced with having to contend with often insurance companies and all of the paperwork that that entails when they're already struggling to sort of regain a sense of normalcy to their lives. So that disillusionment can really lead to low mental health. And so you can see that it's really a jagged edge there when they're in the bottom of that. And anniversaries, of course, of events that have occurred are other phases to be very alert to. But eventually, most people, as I said before, will work through that grief and go into this new phase of reconstruction. What we don't know as well, though, is with repeated disasters, how well does this play out? When a region is hit time and time again with flooding or with heat waves or with wildfires, how are they coping through these phases of recovery? So I just wanted to underscore that. So impacts on communities are far-reaching. We know that there's profound grief for what they've experienced. And of course, there's displacement and relocation in many cases. I'm thinking of wildfires, and people are really separated in different parts of the province. For instance, in British Columbia, that's what happens. So there is a loss of social cohesion. And that was something that was supporting them. So we need to be mindful of that. And what I've witnessed firsthand in the country of Antigua and Barbuda when I went to study the psychological impacts of Hurricane Irma years after, the cultural and the spiritual losses were so great for the people that that also had a big impact on their recovery. And of course, there's significant financial losses that people experience through these disasters. Climate displacement is here and is growing. The World Bank estimates that by 2050, 216 million will be climate displaced due to drought, to famine, etc. And this is not even factoring all the people that will be displaced from war-torn countries. So this is purely climate displacement. So something for us to keep in our mind and to work on. And one of the things we're very good at is building climate resilient communities. I really have a call out for nurses to start doing this as of today. What we can do is organize a community resilience project, for instance. Get together, barbecue, list the skills that are in your neighborhood, the material assets, who has a generator, who has a chainsaw, all these things. To have them in place beforehand is very helpful. Who are the people who can be part of a first aid team? Who's in your neighborhood? Healthcare aides to of course, physicians and nurses. And so to have that team at the ready is really important. How can we as a community enhance our food security? Is there room there to build a community garden, for instance, so that there is more independence that way? How can we get together to put a grab and go bag so we can have those at the ready should we have to evacuate? And most importantly, we want to develop this culture of care and compassion so that communities can really come together to both connect and to prepare as well. So in summary, what I want to say is that nurses play a really important part of this puzzle. As climate events intensify, nurses must go beyond our clinical care to include advocacy, community building, as I just mentioned, and also psychological first aid. And why? Because strengthening this role is essential to an equitable and compassionate mental health response. So on that note, I'd like to thank you, and I look forward to your questions. Thanks for now.
Thank you, Helen, for that wonderful presentation. I took a lot away from that, being a nurse who works in the community, especially on climate community resilience. So I look forward to the Q&A as we can hear more about that work.
Thank you.
It is my pleasure to now introduce Dr. Katie Huffling. Dr. Katie Huffling is a nurse midwife and the executive director of the Alliance of Nurses for Healthy Environments, or ANNIE, the leading global nursing organization focused on the intersection of human and planetary health. With ANNIE, Huffling works with nurses and nursing organizations around the globe to elevate environmental health issues amongst the nursing profession. Huffling is a passionate supporter of nurse-led advocacy in support of healthier environments for all and strongly believes in the power of nursing to create positive change. Katie has many accolades to her name, including the Distinguished Alumni Humanitarian Award from the University of Minnesota School of Nursing and the Charlotte Brody Award. She holds many leadership leadership positions in policy, advocacy, and environmental health, and recently completed 2 terms as an appointed member of the U.S. Environmental Protection Agency Children's Health Protection Advisory Council. Dr. Huffling, welcome.
Thank you so much, Kent, and thank you, Helen, for that wonderful start to our session. I'm so excited to hear from both you and Mary. As I said, thank you so much for the invitation to be here. And today I'll be providing a few different examples from the Annie Environmental Health Nurse Fellowship Program, as well as a book that is coming out tomorrow of what I hope are some really inspiring stories of how nurses are making change in our communities. I feel like right now, sometimes things can feel really heavy, and it can feel like, me as an individual, how much change can I make in the world? But all of us, with 25 million nurses around the world, we can make incredible change. And so I think, it's like we have to find that one little spark that can get us going and keep us going. And so I hope some of these stories do that for you. So who is Annie? As Kent said, we're the only global nursing organization focused solely on the intersection of health and the environment, and we're thrilled to be one of the sponsors of this amazing event. We're free to join. We have tons of great resources, so please check us out. We're always holding lots of webinars, sign-on letters, global opportunities for nursing engagement. So please check us out. I want to just start by talking about the Annie Environmental Health Nurse Fellowship Program. This fellowship program was started in 2019, and it partners nurses from around the country with community-based organizations. By linking historically marginalized, underserved, and overburdened communities with local healthcare providers who are already part of their community, the fellowship program hopes to grow the knowledge and skills of both the nurse working alongside community and also the community-based organization in environmental health. The program serves as a model for health professionals' partnership with local communities to improve health equity, promote community empowerment, and to advance global action for planetary health. And I have to say, every year with this fellowship, the projects that these fellows work on, I am just in awe. They do such cool work. They make such amazing connections with these community-based organizations, and many of them end up, coming onto the organization's board, or they continue the work after the fellowship. It's really just like a launching pad for many of the nurses that are part of the fellowship. So I'm just going to give a couple examples of some of the fellows. And if you go to the website fellowship.environ.org, there's lots more examples of the different work that nurses have been doing. Like it's just really phenomenal. So the first one I wanted to talk about is Mia McPherson, and she partnered with the East Side Community Network in Detroit. This is a climate resilience hub, and working with the Resilience Hub, they recognized that many of the residents in their community didn't have air conditioning and didn't know how to stay safe during extreme heat waves. And so Mia developed a toolkit for community education and outreach, and continues to work with the Eastside Community Network on emergency plans tailored to the needs of the community. And some of the skills that Mia was able to bring into her work with the Eastside Community Network was, as nurses, we know how to take complex health information and make it easily digestible, understandable by the public. And so she was able to take all of this information that previously, I think, just hadn't been geared towards community members about all of the issues related to heat, why it's so important that you need to go to cooling centers and these resilient hubs, and all of these resources. And so it's been a huge success, and they just love working with her. And so now she's working with them on expanding beyond heat waves to other climate related issues. The second one that I wanted to tell you about is Hannah Knoll. At the time, she was working as a school nurse in Charleston, South Carolina. But we loved working with her so much that we ended up hiring her. And now she's the director for membership engagement and professional education at Annie. Sometimes that happens with folks working with us. Like we don't let you go once you start working with us. Um, and so she worked with students in the heavily polluted area of North Charleston, South Carolina. And that's where she had been a school nurse. And she had recognized the many different ways in which kids and families in that area were being exposed to environmental pollutants. And they were becoming worsened by climate change. For example, there's many parts of Charleston that regularly flood during high tide because the water levels are increasing. And so in this after school program that she developed, the students learned about pollution in their neighborhood and participated in climate and community centered storytelling. And so in her work now is continuing to support the next generation of climate leaders. And some of these things that they created are just phenomenal. And they're teaching their parents about it too, which I just love, bringing home this information about what's going on in their neighborhoods. And so we just started our fourth cohort of nurse fellows, and applications for the fifth fellowship will open this fall. So if folks are interested, be on the lookout, sign up for our newsletter because we'll be publicizing that. Currently, it's only open to US-based nurses due to our funding, but we're working really hard to find some funding to open it up globally because at this past cohort, we had about 20% of the applicants were from outside the US, even though we specifically said it was US-based. So it obviously was really causing a lot of excitement for folks. So we really hope that we can expand that. And I am thrilled to announce that this book that Sue Hassmiller and I edited have been working on for the past couple years called Taking Action, Top 10 Priorities for Nurses to Protect Health in a Changing Climate is coming out tomorrow for Earth Day. Kent has a really awesome essay in this around resilience hubs. And pulling this book together and reading these essays from all of these different nurses, seriously, there are some days it made me cry because nurses have there's so much power in nursing. We can do so many amazing things, and there's so much hope in us working together. And so many of the essays within the book are just phenomenal. They inspire me. I'm like, oh, I want to be doing this or that. And we also included within it, after each essay, there's different action items. So it's like everyone, you can pick one or two things. Oh, that would work perfectly in my practice. I can easily incorporate this. And so we're holding a webinar tomorrow at 2 p.m. Eastern on the Annie website. There's a link to register. And also with this QR code here, you can get 10% off if you're a non-Sigma member, but 20% off if you're a Sigma member, if you'd like to get the book. And all of the royalties will be going to Annie. So we're really hoping that lots of folks will get a lot out of this. And so I've got a few examples from the book here. The first one is Adelita Cantu. She's a board member of Annie, and she's a professor at the University of Texas in San Antonio. And for the past several years, she's worked with several local community organizations focusing on Hispanic youth to educate and engage young people in protecting air quality for a healthier community, including each student conducting an act of leadership. And this amazing group of young women, as their active leadership, each gave 3 minutes of testimony to the San Antonio City Council on why clean air is important for their communities. She also met with the council with other climate activists to hold the San Antonio City Council accountable for addressing climate change. And it was through this work that she became interested in the urban heat island effects and its impacts it's having on the communities she's working with. So many of these communities, they don't have tree cover, much more concrete, and they are significantly hotter in the summer than the other areas in San Antonio that have much better tree cover. So she talks about building relationships with these communities and how it takes time and that you need to move slowly. She's now working with several different community organizations to plant trees and build out the tree canopies in the communities hardest hit by heat. They're also working on a project to install a weather station to better track local climate impacts. The next piece is by authors Sheena Ramazanu, Liza Dinarziri Putri, and Nurul Amanina Binte Hussein. And they get the gold star for being the first ones to submit their finished essay. They were so fast. It was amazing. I was like, I wish I could be this organized, but um, as the climate changes, as we know, more and more agricultural workers are being exposed to extreme heat. In many parts of the world, we're seeing more farmers experiencing heat-related illnesses. In their essay, they describe their cross-border multidisciplinary program called the Insira Climate Action Tree Plantation Initiative. This program brings together nurses, educators, public health practitioners, communication specialists, and community health workers, and is spearheaded by universities from 3 different Asian countries. Through this program, they're training farmers in heat stroke prevention. Participants in the program have described how this type of training is life-saving as they are farming in areas where health services are not easily accessed. This group is now hoping to expand this program to a general audience in Indonesia. And then the final example today is an essay by Jocelyn Zavala Garcia and Daniel Jackson Smith. In their essay, they used farm workers as an example of why it's so important for nurses to be involved in advocacy. There are currently no US federal heat standards for workers. Some states have begun to pass standards, but in areas like southern and Midwestern states, where there's a large number of both farm workers and other outdoor workers, there are no protections. Many workers are undocumented or fear reprisal from ICE and so are afraid to speak up about working conditions. Nurses have the opportunity to advocate for farm workers and other outdoor workers to have health protective heat standards, an issue that's only going to increase in urgency. And Dr. Smith actually participated with a number of Annie nurses talking with the Occupational Safety and Health Administration here in the US around federal heat protection standards. And because we had so many nurses that were engaging in this type of advocacy, they actually did a forum with just nurses, a roundtable talking about the issues that nurses are seeing in their practices and why we need to be putting in place federal heat worker standards. Here's my contact information, and thank you so much for having me here today. And I'm really looking forward to hearing Mary's presentation. Thank you.
Wow. Thank you, Dr. Huffling, for sharing your experiences as well as the experiences of the fellows and those that contributed to the book. I'm looking forward to reading the copy. I know that. Yeah, so thank you again for your presentation. All right, we have our next panelist, Dr. Mary Rockwood Lane. Dr. Mary Rockwood Lane is an internationally recognized nurse scholar, educator, and leader in caring science, spirituality, creativity, and nature-based healing. She is an associate professor adjunct at the University of Florida College of Nursing and co-founder of both the University of Florida Center for Arts and Medicine and the UF Center for Spirituality and Health. For more than 2 decades, she has taught and led innovative initiatives that integrate Gene Watson's unitary caring science, aesthetic knowing, and whole person healing into nursing education and practice. A fellow of the American Academy of Nursing, Dr. Lane is the founder of Nursing Way, a national educational platform for supporting nurse well-being, creativity, grief tending, and professional formation. Her scholarship and programs position nursing as a moral, creative, and relational practice rooted in care for self, others, community, and the living earth. Dr. Lane, welcome.
Well, thank you so much. I'm so honored to be here to tell you a story that happened alongside all my professional life because I'm so excited that nursing is kind of standing up and doing this work in the world now. I did this, it was a while ago. I live out on a prairie called Kanapaha Prairie. And first thing I want to do when I start my presentation is honor the ancestral indigenous people that lived on my land. This is like a project that I did in my own backyard. So I'd like to honor the Tamukian tribe and the Pototan tribe that lived on this land, and then they became extinct when white men came here due to wars and starvation. Then the next people, the tribal people that came, were Seminoles and the runaway slaves that tended this land. So this land was occupied by the indigenous people, and the land I live on, you can show the next slide of Kanapaha Prairie, was the last place that the Native Americans stood and defended to the white settlers. And this was a place of the last war. So my land that I'm living on holds a tremendous amount of history and tremendous amount of sorrow and tremendous amount of grief. And I was called to this place because I had a dream. I never was an environmentalist when I came here, but when I came, it was like the land spoke to me. And I felt drawn here. And my story is how I evolved being connected to the land and how I became an environmentalist, but then how I came to understand that as nurses, we are advocates for the environment and the living earth. And that when I went through my journey, I realized the thing that motivated me through all the things that I did was because I was a nurse and I was so passionate about healing the earth and healing the people. This land that I live on comes up on a Kanapaha Prairie. It's about 1,000 acres, and it is a ecosystem where a lot of the county around here drains through the ecosystem directly into the aquifer. So one of the things about this property is it really, the irrigation and the protection of the water is so important. It also was a place where the ecosystem is very fragile. It either floods or goes into drought. And here there are deer out here, there's wildlife out here, there's all kinds of, sandhill cranes from Nebraska. 3,000 sandhill cranes would come down here and have their babies and nest on the prairie. So I was very connected to this land, and I really became deeply connected because one time I went out on the prairie and I was watching the sunset, and I felt so called here that I was watching the sunset and I saw the moon rise behind me. And what was really incredible is an owl flew down. I didn't know owls were territory. It was a great horned owl, flew down and hit me in the head. And when it hit me in the head, I fell to the ground and I suddenly felt like I was being watched. And there was somebody waiting for me. And I had this experience that the ancestral Indians of the land were present. And I thought, why am I experiencing this? But that's what this story is going to unfold. As time went on, I began to really become deeply connected to the earth here. And there was a particular, I'll show you the next slide, a grandmother tree, that I would go sit under this grandmother tree and sort of like, what can I do? And what ended up happening, the developer who owned the prairie, 850 acres, was going to sell the prairie, and they were going to destroy the prairie, with development and everything. And I decided that I was going to do something, and I wanted to protect the prairie. I wanted to protect it as, a place where, the water went into the earth, it went directly into the aquifer, the neighbors were all around, and how can we protect the land that we live on? So I became very intimate with the land, and I went to see the developer, and I said, I don't want you to sell this land. I don't want it to be developed. And in his office, there was this big poster behind him, and it said, the earth first, the other planets later. And I said, really, what is wrong? You're developing the whole earth. And I said to him, can I do something to protect the property? And he goes, well, Mary, I'll give you some time to see if you can raise the money to buy the prairie, which was over $1 million. And then you can do what you want with it. You can put it under conservation. You can do whatever you want. And I said, okay. So I decided I was going to raise the money to buy this land, to protect it and put it under conservation. So the sandhill cranes could come back, so we could maintain the environment. So what I ended up doing was and this is what I think we do as nurses. And this is what, when we're, as nurses, it's like, I really realize that this is like, I want to do something to protect the earth. I want to do something to protect wildlife. I want to do something to protect the trees. And I decided I actually raised over $1 million. I met with everybody who lived at the prairie. I met with the county. I met with federal, state people. Did grants. And this was a very big project that I did in my life. And it took a long time, but I met with all the different people about the prairie. And I said, I really want to save this money. So I actually raise the money. It was like a gift of, $20,000 or $1,000. I had one benefactor, though, that came to the table who was a nurse, who gave me almost $650,000, which I would have never expected in a million years. So I raised the money, and then I went to the county, and I went through with the different environmental people in the community, the Alachua County Trust and Land Management and the Florida Act. It's like, what I ended up doing is just it took a time, but it was like, and I meet these people and they come to you, and people come and they help you, and suddenly you have a vision, and we put it under conservation. But the funniest thing was, a story I want to tell you is, I was really, it was kind of wild because I live on the prairie. So I have a house that overlooks this oasis, and then beyond it is this big prairie. And it was the wildest thing. Every day, these sandhill cranes would come up behind my kitchen window. And I had the feeling that the sandhill cranes were there to remind me every day that they couldn't speak the language of human beings, but I could, and that I needed to protect the prairie for them. So I remember going to the closing, and I had collected all these elements. It was all these attorneys. One was the developer's side. One was all the different people's side. And, human beings are very much, I want this, I want that. But I remember saying in the closing that we are buying the prairie for the sandhill cranes and for the water and to save this environment. Well, you can imagine they were like, who is this woman? But what happened is I realized that I was doing something I was called to do. And now that, this work, protecting this prairie, raising the money for the prairie, meeting the county commissioners, meeting the people in the county, finding out about the conservation environment, working with people on how do we manage the land, how do we educate ourselves, how do we teach our community what are the best land management practices. For a long time, I realized one day, I said, I think this is who I am as a nurse. And this is before this movement. And I realized, because I thought, why am I so passionate? And I realized, people want to save the environment for the environment. And of course, I want to save the environment for the environment. And of course, I want to save the environment for the deer and the hawks and the sandhill cranes and all the animals that are out here are wild. And it's really beautiful. But I said, we need to save this earth for future generations. We need to save this earth for clean water for human beings. And I came to this realization through this journey that as someone who cares passionately about human health, I realized when we save the earth, we are protecting not only the earth, but we're protecting ourselves as human beings. And this is a public health issue. This is not just saving a tree. What I realize is I can speak as a nurse that I'm not just doing this for the wildlife, but I'm doing this for my community. I'm doing this for the health of the people that live here and for the people that are coming. And I realized as I went through this journey that it was my role and my responsibility and my commitment of being a nurse that really was a driving force inside of me. And because I had I stepped into like a place of kind of confidence because I was a nurse. I can represent, I am saying this as a nurse, what's important for human health. And that was a remarkable realization for me. And I remember thinking, caring for the earth, because I work with Jean and I work with bringing caring science into hospitals. And it's like a language that we're communicating and how we can be advocates for, patients and families and change the culture. And since I became, just recently, I went out into the forest and I had gone through my own health problems. And I heard my tree say to me, "We've been waiting for you." And I said, wow. And then I found out there's this association for forest bathing. So I took this certification for forest bathing. And now I joined another organization called Nature as Medicine, which is made up of physicians and nurses and psychologists and therapists to prescribe nature for health. And it's like taken me a full circle to sort of come to this place where it really is true. Like everything that everyone's talking about as we are earth and the earth is within us. And when we care for the earth, we're caring for ourselves. And the image of the planet that, Artemis sent back to the earth is true. And I think my message in my story is we don't have to go. I mean, it's what everyone's talked about is wonderful, but I realized just my going out in my backyard and thinking, what can I do? And connecting with the trees and connecting with the environment and actually connecting with the ancestral ancestors, the indigenous ancestors of the land. I think they're waiting for us. I think they feel that we're here. And because of who we are as nurses, we are in a great position to truly save the planet because of who we are as healthcare providers and because we are trusted. And I found that there's power in that. There's power in our voices. And I think this planetary conference is highlighting so many people, so many of us that are waking up. And it's just an amazing time to be alive. And, we're researching and forest bathing all the health benefits of nature. Of course, that when we go out in nature, it boosts our immune system and it regulates our blood pressure. But also you realize it's the air that I breathe. It's the water that I drink. It's all the food that I eat. It's everything. And I'm just so excited to be part of this. And this, I just found, Divish told me about this planetary. He says, "Oh, I would love to be involved. I have a story I can share." And I think I did it because I was a nurse. And she says, "Well, I'd like you to be a presenter." So I just want to say thank you to everyone for honoring this work that we're doing. And how much time do I have? I don't know if I have very much time left. I can share a little bit what I'm doing now. Do I have time? Okay, good.
Go for it. Yeah.
Okay, good. I have created a platform for nurses called the Nursing Way. And what I am advocating is for, nursing, we are this planetary health. Nursing is, they're called the great, like I think in one of is that we are part of the great transition. And I invite nurses to make art. And I wanted to share this particular one of the nurses took my course, Healing with the Arts, and I have an online course that has over 100,000 participants in it. And nurses take this course, and now I'm working on creating a nurse gallery. But Ruth did these beautiful paintings of nature. And I think it's, nature, returning to nature and returning to art and nature being an inspiration for our creativity is so important. So I'm now building this gallery where I'm showcasing nurses who are making art and honoring the creative emergence of nursing, because I do feel that we are changing at the level of our identity. We are transcending our traditional roles, and we were becoming artists, and we are changing the planet, and we are expanding our identity of what we are capable of doing on the planet. So I just feel like we are at the threshold of a new beginning, as the old world as we knew it is not going to be what it was, because there's so many changes that are happening. But I do believe there's a new emergence that's happening, and this crisis is calling us to transform and change and move beyond our traditional roles, where we can emerge and be exactly what the earth needs for us to be right now as nurses. So I just wanted to thank all of you for inviting me to share my story.
Wonderful, wonderful. Thank you, Dr. Elaine. That gave me goosebumps. I appreciate you for sharing your story and motivating me, and I hope our panelists and audience members to continue with this work or get started with this work if we haven't yet. We do have a question from Diva Marie that we'll start with, but I also want to get back to the other panelists as well. The question is, Mary, have you or can you shape a how to conserve land such as your prairie for others to do what you have done?
I would love it. I think this is the right time. I never have shared this story before. in this way. It's just something that I did. And when you invited me to the conference, I was like, oh, I've got a story. I actually saved, I actually raised all this money and saved this 1,000 acres. Maybe I could tell that story. And I think now's the time that I could do that. I could write it. And now I think, there's a interest in what are we doing as nurses and as citizens of this planet. And I would love to do that. And I think this is exactly the right time. And this conference inspires me and motivates me that we are here together and we have each other and we're supporting each other. And I can't wait to meet all the other people that are doing this work because I didn't present it in an academic way, but I would definitely love to write about it's a storybook and it's a lot to do, but it can be done. It can be done, despite what you think. You just have to never give up. Never give up.
That's right. That's that story of resilience. Yes, absolutely.
Exactly.
Well, I have a couple questions that I can ask, and also want to open it up to panelists if you have questions for one another, and also just reminding our audience members to post questions to the Q&A if you have any. Climate change and other anthropogenic disruptions are wicked problems, requiring transdisciplinary, solutions-oriented approaches. What role do nurses play, especially at the public health level? And I know some of you touched on this in your presentations, but if you want to elaborate on that or share more stories about different ways that nurses can be involved or have been involved.
Well, I think one way that where we really need more nurses involved is whether it's working with local governments, state governments, running for public office. Like nurses need to be at the table. I know in the county that I live in, I volunteered for a couple years when they were writing our county climate plan. And I was the only health professional on there. Like they were kind of running around health on the edges, but they just weren't explicitly saying some of these things. And so I think, it can be a really nice way for nurses to use, our nursing skills. And it's something that really benefits the community. Like I made sure, that they were looking at like who's most vulnerable in our community. And in our climate action plan, are we making sure that if when climate events happen, that we're taking care of those people.
And the other thing I think that nurses bring to the table is, when there was a period of time when we were fighting a cement plant and, really looking at the data that, these when you build these things and you disturb the environment, there's a lot of data out there that shows the ill effects on public health. And as a nurse, you come into a county commission meeting and say, I'd like to present the data, how this is going to impact on people's health. And I think we're at a time now that we weren't maybe 15 years ago, where people are really, we talk about evidence-based. We need to be able to present the information of the impact that this has on people's health. And people just don't know it. They just don't know it. And, I think my feeling was, when I was doing this, I just reached out to, it was conversations. I had conversations with people. I just called people, and talked to them about what my concerns were and what was happening and how is this impacting on the environment, and just asking those powerful questions so people can really be aware of what they're doing. Because a lot of times people destroy the environment and they don't even admit it they don't admit it, that it's actually what's happening. And we kind of say, do you, not in a very informed way, do you realize what is happening to the earth? And just, communication. It's really communicating and not being quiet and standing up and giving voice to the earth, like giving voice for the sandhill cranes, giving voice for the trees, giving voice to the water systems that we need to protect. We are here to give voice. And I think that's what we need to just start doing and not need to be invited to the table.
I just want to chime in. I totally agree. It's sort of like elbows up trying to shimmy our way in there. So similarly, we here in Canada have done a lot of advocacy to educate the public about the health harms of liquid natural gas and the impact, and because the developments take place in northern British Columbia, very close to Indigenous communities, there are significant risks to both the health of Indigenous women and from these men camps who are being sexually exploited, but there's also the health harms from the flaring that occurs and the incidence of increased leukemia and all those health harms. But for the Indigenous communities, that their ceremonial medicine is being affected by this, or even their staples of blueberry, or the caribou that are drinking in these tailing ponds of water that's contaminated. So I totally agree. People are unaware of it, and because it's out of sight, it's out of mind. And yet, when I talked in my presentation about people that are disproportionately impacted, this is for us to have the voice for those who do not up there, and who economically certainly don't have much choice because that's the going industry in that region. So I totally agree with what both of you were saying about how important our voice is. And I know that we've gone frequently to municipal councils, and I remember city councilors say, the nurses are here.
Nurses are
Meaning,
here.
and I loved it. It was just like, whoa, it's just the nurses are here. And so that spoke to, and they'd see us in the audience and that we were in favor of a certain motion that was protecting health. And I think that we need to replicate that in every corner. So
Exactly.
thank you.
Yeah. Oh, that's
I looked at
wonderful.
I looked at all the people that are presenting. These are educated people, are, all these nurses are in powerful positions. And one of the things I want to say is we need to go beyond our roles of just being a professor at the University of Florida or, wherever it is. We have to become it, to me, being a nurse is like it's in all aspects of my life. It's not just a job that I have. It's something that because we're nurses, we have a covenant with humanity. And because we're educated, there is a tremendous amount of responsibility in what we can offer the world at this time. And the world needs us now. So I just feel like we have to encourage each other and support each other to bring our work out in the world.
Yeah, absolutely. I love that being at the table, making space for ourselves at the table, going without the table, and using our platforms as trusted messengers, trusted within the community, to elevate the concerns of environmental degradation and provide solutions that are evidence-based as alternatives or counter to what may be talked about in terms of development in other ways. So absolutely agree with that. And I also like, you all touched on it a bit, but that transdisciplinary piece, not only in the sense of having multidisciplinary teams or groups working on issues, but showing up as ourselves in a transdisciplinary way. Who are we? We're nurses, but we're also artists. We're also storytellers. We're also environmentalists, and bringing all of that to the table.
Yes.
We are at time, although I think there's a little bit of a leeway between the next session. So I would like, as kind of a last sign off from panelists, a word, a sentence, a passage of advice. What advice might you have for nurses who are working in public and or community health who want to work towards planetary health but don't know where to get started? We see this a lot across healthcare professionals, that there's this understanding of the challenge and the need, and the barrier is I don't know how to get started.
Well, I can just say something. You know, we are the ones that we've been waiting for, and
Mm.
there's never been a more important time to be a nurse. And I think giving voice to this work that we're doing in planetary health as a trusted profession, that we can make a difference. Like just, you know, just look at what's around us and do just one action at a time and take one step every day, and you'll make a difference in some way and somewhere.
I think similarly for me, it would be, you know, start with what you have in terms of your skill set and where you are. And be in community. Community resilience, I think it really is in this phase of where we are with the state of our planetary health. So that would be my takeaway.
Yeah, I agree with both of you, and not to like keep tooting the new book coming out, but there's so many action items in here, so many in I loved it. Different authors came up with just fabulous ideas, things I had never thought of. And so I think I think leaning into the your creative juices, and really thinking about what you're passionate about and how you can use, your nursing skills, that passion, how they can come together in climate action. I think being creative, the sky's the limit.
Yeah, absolutely. I From the three of your presentations, what I took away, my call to action is aligning purpose, passion, and what we do. And Dr. Lane, you said doing the work we were called to do. And I think that with the arts and the creativity and community focus, all of that together just really sums up how and why nurses need to be involved in this space. Um, I want to thank all of our lovely panelists. Thank you so much for joining us, for sharing your wisdom, knowledge, and stories. I greatly appreciate it. There is another session after this. We're asking and inviting all audience members, panelists, everyone to come together in this last session for kind of a final Q&A and send off for this wonderful event. So thank you all, and we'll see you over there.